WellSpan Cancer Institute is proud of its efforts to truly listen to patients, allowing experts to customize treatment options while offering compassionate care. I talked with Dr. Nick Concorker.
Doctor, it's great to have you with us today on this special program. It looks like WellSpan is doing a lot to truly increase access and services for patients. How does WellSpan Cancer Institute really personalize treatment plans for each unique patient?
I think we try to achieve that in a couple of important ways. One thing we're doing across our most common disease sites, and those include breast, lung, colorectal, and prostate cancer, is building comprehensive programs around those. So by having programs in place that really kind of streamline the way a patient's care progresses through our system, we're getting patients through the system more quickly. We're getting to the care they need much more quickly. In addition to that, we are, where we can, streamlining care in other ways. So I think a great example is what Dr. Tidable spoke about just a little bit ago, a case in which we used our ion navigational bronchoscope to help get a diagnosis. We've now had a handful of cases with more scheduled as sessions in which a patient will get a diagnostic procedure like that bronchoscopy and then go right into the operating room for the resection. So it's an example of a patient really going from a suspicious finding to diagnosis to treatment in a single session. As you can imagine, that greatly improves the experience of care and greatly cuts down on the anxiety that patients have as they're progressing through their treatments.
Well, on that same note, cancer diagnosis, that's a really scary thing for a person, for a family. So how does WellSpan Cancer Institute really work to provide compassionate and comfortable care?
And to know that you're going through your care with people you can trust, I think is of great comfort. We've got fantastic nurse navigators in all of our centers. Those nurse navigators are a touch point for patients for any questions they have as they're going through the process of care, whether it's about when appointments are scheduled or something they might need for to treat a side effect. I think patients can also feel comfortable knowing that their care is being discussed behind the scenes by all members of their team. We have specialized fora in which our physicians and nurse navigators and social workers talk to each other and coordinate what's going to happen with a patient. So to have the knowledge that your case is being discussed among your care team, that your care is going to be coordinated, I think and hope is a real comfort to patients and is an important element of the compassion that we hope we bring to patients' treatments.
Let's talk about this treatment. Like, what sort of advanced medical technologies and techniques is WellSpan Cancer Institute using?
WellSpan has been really at the forefront using artificial intelligence for early diagnosis. Our radiology team has deployed AI to note suspicious findings on scans and to flag those findings for radiologists to then review. So a suspicious finding is getting acted on and sort of advanced to the next level very quickly through AI. When it comes to treatments, we have the most advanced surgical robots that are available. For certain types of cancer care, and colorectal is one that comes to mind, we know that outcomes are actually improved with robotic surgery. Again, leveraging technology on behalf of our patients. One of the things that I am most proud of is we're really trying to move upstream to predictive care. We have a very unique program that we call our Gene Health Project. And among other things, the Gene Health Project identifies patients who are at risk for certain types of cancer, patients who harbor what's called Lynch syndrome, which is a syndrome that puts patients at risk for multiple types of cancer, patients who may have hereditary orientation towards breast or ovarian cancer. Those patients are being identified through our Gene Health Project before there's any screening indicated, before there's any sign or symptom of a potential problem, and they're really getting funneled towards preventive care. So another example of how scientific breakthroughs are being leveraged on behalf of our patients.
Doctor, thank you so much for being part of the program today.
My pleasure. Thanks for having me.
For more information, or if you would like to make an appointment with WellSpan, visit wellspan.org/genehealthproject.